Antimicrobial resistance, often called AMR, is a growing global health concern. It happens when microorganisms like bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines. This makes infections harder to treat and increases the risk of disease spread, severe illness, and death. In this video, we'll explore what AMR is, why it's happening, and what it means for our future. Let's begin by understanding the basics of this silent but serious threat. Microbes are incredibly adaptable. When exposed to antimicrobial drugs, some may survive due to random genetic mutations. These survivors multiply, passing their resistance on to future generations. Over time, entire populations of microbes can become resistant to drugs that once killed them. This process is natural, but it's being accelerated by human actions, making it a major public health challenge. AMR threatens the effectiveness of modern medicine. Common infections and minor injuries that have been treatable for decades can once again become deadly. Procedures like surgeries, cancer treatments, and organ transplants rely on effective antimicrobials to prevent and treat infections. Without them, these medical advances are at risk, putting millions of lives in danger. Antibiotics are among the most commonly used antimicrobials. They have saved countless lives since their discovery. However, overuse and misuse of antibiotics in humans and animals have contributed significantly to the rise of resistance. When antibiotics are taken unnecessarily or incorrectly, bacteria have more opportunities to adapt and survive. It's not just antibiotics that are affected. Antivirals, antifungals, and antiparasitics are also losing their effectiveness due to resistance. This means diseases like HIV, malaria, and fungal infections are becoming harder to treat. The loss of effective antimicrobials threatens global health security. Resistant microbes can spread between people, animals, and the environment. Poor infection control, lack of clean water, and inadequate sanitation all contribute to the spread. International travel and trade also help resistant microbes cross borders, making AMR a truly global issue. Healthcare systems worldwide are feeling the strain of AMR. Hospitals face longer patient stays, higher medical costs, and increased mortality rates. Treating resistant infections often requires more expensive or toxic drugs, and sometimes there are no effective treatments left. This puts additional pressure on already stretched healthcare resources. The economic impact of AMR is significant. Resistant infections lead to longer illnesses, more doctor visits, and greater use of expensive medicines. This increases healthcare costs for individuals and governments. Productivity is also affected, as people are unable to work due to prolonged illness or disability. Antimicrobials are widely used in agriculture to prevent disease and promote growth in livestock. However, this practice can contribute to the development of resistant microbes, which can then spread to humans through food, water, and the environment. Responsible use in agriculture is crucial to slowing resistance. The environment plays a key role in the spread of AMR. Waste from hospitals, pharmaceutical factories, and farms can contain antimicrobials and resistant microbes. When this waste enters water sources, it can spread resistance even further, affecting wildlife and human populations alike. Overprescribing antimicrobials is a major driver of resistance. Sometimes, doctors prescribe antibiotics for viral infections where they have no effect. Patients may also pressure healthcare providers for unnecessary prescriptions. Reducing overprescribing is essential to combat AMR. Self-medicating with leftover or unprescribed antimicrobials is risky. People may take the wrong drug, dose, or duration, which can promote resistance. It's important to only use antimicrobials as directed by a qualified healthcare professional. Not finishing a prescribed course of antimicrobials can leave some microbes alive. These survivors are often the most resistant and they can multiply, making future infections harder to treat. Always complete the full course even if you feel better. Counterfeit or substandard antimicrobials are a serious problem in some regions. These drugs may not contain enough active ingredient to kill microbes, allowing resistance to develop. Ensuring access to quality medicines is a key part of the fight against AMR. AMR knows no borders. Resistant microbes can travel quickly across countries and continents through people, animals, food, and the environment. International cooperation is essential to monitor and control the spread of resistance worldwide. The One Health approach recognizes that human, animal, and environmental health are interconnected. Combating AMR requires coordinated action across all these sectors. By working together, we can develop more effective strategies to slow the spread of resistance. Tracking the spread of AMR is vital. Surveillance systems collect data on resistant infections, helping health authorities identify trends and outbreaks. This information guides policy decisions and helps target interventions where they're needed most. Developing new antimicrobials and alternative treatments is crucial. Research also focuses on rapid diagnostics, vaccines, and infection prevention. Innovation is needed to stay ahead of evolving microbes and ensure we have effective tools to fight infections. Preventing infections in the first place reduces the need for antimicrobials. Good hygiene, vaccination, and infection control in healthcare settings are all important. Simple actions like handwashing can make a big difference in stopping the spread of resistant microbes. Vaccines prevent infections, reducing the need for antimicrobials. This helps slow the development of resistance. Expanding access to existing vaccines and developing new ones are important strategies in the fight against AMR. Raising public awareness about AMR is essential. People need to understand the risks of misuse and the importance of following medical advice. Education campaigns can empower individuals to take action and protect their health. Healthcare professionals play a critical role in combating AMR. Ongoing training ensures they prescribe antimicrobials appropriately and follow infection control protocols. Well-trained staff are essential for effective prevention and treatment. Antimicrobial stewardship programs promote the responsible use of antimicrobials. These programs guide healthcare providers in choosing the right drug, dose, and duration. Stewardship helps preserve the effectiveness of existing medicines for future generations. Governments and regulatory bodies have a key role in controlling AMR. Policies that restrict over-the-counter sales, regulate agricultural use, and ensure drug quality are vital. Strong regulations support public health and slow the spread of resistance. AMR is a global problem that requires international cooperation. Countries must share data, resources, and best practices. Working together strengthens our ability to detect, prevent, and respond to resistance threats. Pharmaceutical companies are vital in developing new antimicrobials and ensuring drug quality. They also play a role in responsible marketing and distribution. Collaboration between industry, governments, and researchers is needed to address AMR effectively. Developing new antimicrobials is difficult and expensive. Many companies face financial and scientific challenges. Incentives and support from governments and international organizations can help overcome these barriers and encourage innovation. Rapid diagnostic tools help healthcare providers quickly identify infections and choose the right treatment. This reduces unnecessary antimicrobial use and helps slow resistance. Investing in diagnostics is a smart strategy for fighting AMR. Researchers are exploring alternative therapies such as phage therapy, probiotics, and immunotherapies. These approaches may offer new ways to treat infections without relying solely on traditional antimicrobials. Continued research is needed to unlock their full potential. Good hygiene practices such as handwashing and safe food handling are simple but powerful tools against AMR. They prevent infections and reduce the need for antimicrobials. Promoting hygiene in communities and healthcare settings is essential. Access to clean water and proper sanitation is critical for preventing the spread of resistant microbes. Investments in water infrastructure and hygiene education can have a big impact on reducing AMR, especially in low-resource settings. Healthy animals are less likely to need antimicrobials. Improving animal husbandry, vaccination, and biosecurity on farms can reduce the need for drugs and slow the development of resistance. Animal health is a key part of the One Health approach. Food can be a source of resistant microbes. Safe food production, processing, and handling practices help prevent the spread of resistance. Consumers also play a role by cooking food thoroughly and practicing good kitchen hygiene. International travel can spread resistant microbes quickly. Travelers may carry resistant bacteria from one country to another, sometimes without knowing it. Practicing good hygiene and following travel health advice can help reduce the risk. Communities can take action by promoting hygiene, supporting vaccination, and advocating for responsible antimicrobial use. Local leaders, schools, and organizations all have a role to play in raising awareness and protecting public health. Patients have a responsibility to use antimicrobials correctly. This means following prescriptions exactly, not sharing medicines, and never using leftover drugs. Being informed and responsible helps protect everyone from the threat of AMR. Schools can educate students about AMR, hygiene, and responsible medicine use. Early education helps build lifelong habits that protect health and slow resistance. Teachers and parents can work together to reinforce these important messages. Media plays a powerful role in shaping public perceptions of AMR. Accurate reporting and awareness campaigns can inform the public and influence behavior. Responsible media coverage supports efforts to combat resistance. If we fail to act, AMR could reverse decades of medical progress. Simple infections could become deadly and routine surgeries could become too risky. The cost of inaction is measured in lives lost, economic damage, and a future where medicine is less effective. Despite the challenges, there is hope. Advances in science, global cooperation, and increased awareness are making a difference. By working together and taking action now, we can protect the effectiveness of antimicrobials for generations to come. Every individual can contribute to the fight against AMR. Simple steps like washing hands, getting vaccinated, and using medicines responsibly make a big difference. Together, our actions can slow resistance and save lives. Technology is helping us track, prevent, and treat resistant infections. From advanced diagnostics to data analytics, new tools are making it easier to respond to AMR threats. Embracing technology is key to staying ahead of evolving microbes. AMR is a threat to global health security. It requires coordinated action from governments, organizations, and individuals. By prioritizing AMR, we can strengthen health systems and protect communities worldwide. Now is the time to act. Whether you're a healthcare worker, policymaker, researcher, or member of the public, everyone has a role in combating AMR. By making informed choices and supporting effective policies, we can turn the tide against resistance. Antimicrobial resistance is one of the greatest health challenges of our time. It threatens our ability to treat infections and protect public health. But with awareness, innovation, and collective action, we can preserve the power of antimicrobials. Let's work together to ensure a healthier, safer future for all.